for a very good cause. I hope you stay with us. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. Here in California, we all love the outdoors. Golf, tennis, going to the beach. However, the sun can play havoc with the delicate skin on the back of the hands and neck. Call or click today to learn the newest methods for restoration and beautification of the hands, neck, and other areas affected by the sun. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. One of the common goals I share with my patients is that they look natural after their facial rejuvenation.
Dr. Morwood made me feel really comfortable. His staff is phenomenal. Going into his office is always a great experience.
Call or click today to learn how our combined approach of art and science can enhance your natural beauty. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. A smooth, firm neckline is a universal sign of beauty in both women and men.
Dr. Morwood not only helped me regain my confidence, he helped me achieve the best version of me.
Call or click today to learn how the natural neck lift can rejuvenate your beautiful neck and jawline. Welcome back to the Doctor Is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon right here in beautiful Monterey, California. Thank you very much for joining us. What I'd like to do in the next few minutes is talk about med spas and what is a med spa and what's going on in my office. Well, many of you have heard in my office, actually in the adjacent spa, we are building right now Revitalescence Monterey. You may know that in Salinas there's a very successful, very busy med spa called Revitalescence. That's in Salinas with Dr. Matt Romans and Dr. Jeremy Silk. Excuse me. And what we're doing is expanding. I'm delighted to announce that we're expanding to Monterey. We're building out the space adjacent to my office. And so the three of us are connected. There's some beautiful glass doors that connect the medical spa to our surgical office, and we're able to offer med spa treatments with nurse injectors. And what I'd like to do is give you a little introduction to what a med spa is, because I've been telling some people that I'm looking forward to the opening of our medical spa, med spa, and some people say, well, what's a med spa? Does that mean I can go there and get a massage? Does that mean I can go there and get my hair cut, or I can stay overnight and get some steam treatments? Well, there are different spas, of course. There are day spas and there are European spas where you travel to and you can take a week or a weekend and get all sorts of treatment. But in summary, med spa is short for medical spa. We're opening the medical spa, med spa, and laser center. So essentially what a med spa offers is minimally invasive and non-invasive treatments to improve your appearance, oftentimes administered by registered nurses, and the medical directors of our med spa, of course, are the three of us plastic surgeons, myself, Dr. David Morwood, Dr. Jeremy Silk, and Dr. Matt Romans. All three of us are board-certified plastic surgeons. I'm a member of the Aesthetic Society, American Society for Aesthetic Plastic Surgery. We're members of the American Society for Plastic Surgery, that's ASAPS and ASAPS. So we will have nurse injectors. So based on their license and with proper medical supervision, for example, by board-certified plastic surgeons, what are some of the treatments that will be offered through the med spa? I think that there are different categories of treatments. The first type of treatment that I'd like to tell you about will have esthetician services. So an esthetician is a trained and licensed person in California who can do skin analysis, who can do facials, who can teach you how to properly cleanse your skin, who can get you started and coach you on what skin products to use at home. You've heard me talk about one of the easier ways to improve your appearance is by proper skincare. I'm a big believer in getting facials, having skin analysis, and so the esthetician can teach you about your skin, how to properly cleanse it, that we can help you categorize your skin, properly cleansing, rejuvenating, exfoliating. We're going to remind you that smoking, whether direct smoking or secondhand smoke, is not great for you. We're going to encourage you to stay out of direct sunlight, and when you do go outside, to use sunblock. So those are, I think, really straightforward and very valuable teaching tips that the esthetician can give you. The esthetician is licensed to do certain peels, superficial peels of the epidermis to help exfoliate. Some microdermabrasion coached by the nurse or supervised by the plastic surgeon can be done. We can offer silk peels. So we can help you sort of punctuate your own skincare at home. We can steer you towards medical grade skincare products with the esthetician and the nurse, oftentimes coached by the plastic surgeon. So we can steer you in the right direction for proper skincare. So I'm a big believer that in the esthetician doing facials, analyzing your skin, coaching you about cleansing, avoiding the sun, encouraging your skin to regenerate and exfoliate, properly moisturize, etc. Now, what about the nurse injectors? The nurse injectors oftentimes are much more experienced than many doctors at injectables like Botox and fillers. Botox is a muscle relaxant. It can be very effective in minimizing the furrows in between the eyebrows. The company calls those the 1s or the 11s or the 111s. It's very effective to minimizing those grooves in between the eyebrows. We can do a microlateral brow lift just by using Botox. We can soften the lines on the sides of the orbit, sort of towards the ears. We can soften those. There are a couple other things that we may be able to do for you that may be considered off-label. Soften the platysmal bands, turn up the corner of the mouth, etc. We may be able to turn up your lip just a little bit so more of the red shows, so you don't seem to have such a long upper lip. That's all done with Botox because Botox is a muscle relaxant. It's done right in the office, nurse injector supervised by the plastic surgeon. We can use a small number of units for something specific. We can use a larger number of units. There's certainly a safety limit on what we can do in one day. But Botox can be very effective in relaxing certain muscles. Now, you may have heard that also Botox can be effective for hyperhidrosis or excess sweating. It can help to relieve migraines. Those are all medical indications. I sometimes use Botox to relieve spasm after a TIA or stroke in the hand or wrist. There's something called the stiff man syndrome where muscles are so rigid and contracting that the person has a hard time with activities of daily living. Botox as a medical treatment can be very effective. What about fillers? That's the other sort of part of injectables. Fillers, you've heard me say, can revolumize. They can be very effective. It's a lunchtime treatment. I think fillers are great to restore volume loss in the midface, in the temples, around the piriform sinuses, under the nasolabial folds, to improve the appearance and the volume of the posterior mandibular angles. That's a very in vogue look now in Hollywood, to have prominent posterior mandibular angles. So fillers can be very effective. They can be done with just ice and topical cream, or you may want to get a dental block before we do filler injection. And that's something that the nurse is really good at and can do. Now, what about skin resurfacing and laser treatments? It's, as I said, Revitalescence Med Spa and Laser Center. Laser is a very powerful tool that can do lots of different things. You may think about lasers traditionally to resurface the skin. Certainly that's true. A laser can rapidly and dramatically exfoliate the skin to encourage new baby cells to grow from underneath. I think laser can be effective at that. Sometimes I prefer TCA peels. TCA peel is like a surgical peel that I do in the higher concentrations. That contrasts to a very low percentage TCA peel that the nurse or esthetician can do. So laser can resurface your skin. We can zap little blood vessels. There's something called IPL and BBL, intense pulse light, and broadband light, to stimulate the dermis and exfoliate, stimulate the growth and restoration of your skin. We can lighten hyperpigmentation with lasers. There's another use of lasers that I'm really excited about, sort of a halo treatment, and that's a dermal stimulation. So we can adjust the settings so the dermis is stimulated to create more collagen, more elastin, more hyaluronic acids over the course of the following 6 months. It doesn't have to be a simultaneous exfoliation. It can be, but I think that one of the exciting new ways we use a laser is to stimulate the dermis. Certain lasers can help with excess sweating. You may have heard about feminine rejuvenation, that type of laser to help rejuvenate the feminine anatomy, to minimize leaking and improve people's sexual health and experience, etc. So lasers can be very valuable. What about body contouring? You've heard me talk about, there are 3 broad categories to body contouring. Number 1 is the open approach. That's surgical. That's where we make incisions and remove big blocks of skin and fat. We can tighten up muscles on the inside if need be. The closed approach is essentially liposuction. That's where I make very little incisions. I put in a cannula called it's a cannula. It's a tube, and I vacuum out fat cells. That can be very profound, very potent, but it doesn't remove skin. It doesn't tighten up muscles. Now, the other way we do body contouring is with the use of external devices, such as cool sculpting and other treatments such as infrared or heat. We believe in cool sculpting. There's good scientific data to indicate that cool sculpting works. It was designed by some doctor engineers at Harvard. It was first noted in children who do a lot of sucking on things like icicles or popsicles that are cold, and they sort of are addicted to them, but they do that frequently. There was some fat wasting noted around the mouth. Also, in certain parts of the world where people ride horses in the cold a lot, and the chaps and the horse clothing, or I should say the equestrian clothing, expose their lateral thighs, researchers began to notice that they would actually lose some fat in those areas when it was frequently exposed to cold. So, cool sculpting essentially is a way of freezing fat. We have an applicator, and the computer will sort of supervise, describe, is in charge of applying a vacuum, and skin in the fat is, no incisions are made, no anesthetic is needed. It's drawn into the platform, and the computer lowers the temperature of the tissue, and the fat is essentially frozen for about an hour. Now, over the course of the ensuing 12 to 16 weeks, approximately 18 to 24% of that subcutaneous fatty layer will be dissolved by the body and absorbed. So it's scientific, it's documented. There are some potential downsides. Something called a rebound fibrosis can occur, but we need to talk to you about all of those true indications, realistic expectations before embarking on this. But cool sculpting can be a very effective mode for contouring a very isolated area. Let's say you go to the gym a lot and you have a couple areas of fat deposition that are resistant, and you really are not a candidate for an open approach like a tummy tuck. You're not in the favor of lipoplasty at this time or microliposculpture, but you would like those areas treated. I think cool sculpting can be very effective in instances like that. There are other treatments that we can offer at the med spa, such as lymphatic massage, great skincare, as I said, helping you to select medical grade skin products for you, injectables, Botox, fillers, etc. And because our offices are connected, we have the surgical plastic surgery office where we do plastic and reconstructive surgery, oftentimes in the office or in the operatory, smaller operations, connected right